most famous physical therapist on the internet.
Hi, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to discuss the best mattress for back pain according to science. Plus, this is going to fit right in.
Okay.
We're doing a giveaway, Brad.
All right.
It's the SleepOvation Mattress.
He said mattress.
Yeah, so it's going to be really cool. If you want to participate in that, go ahead, Brad, show the sign. Just go to bobandbrad.com. and go to the giveaway section, and we're just going to need your email so we know how to contact you.
Right.
And your name. Or you can also go to Bob and Brad on Facebook. It's pinned to the top of the page. And if you want a shorter version of our lives of these videos, go to Twitter or Instagram. So we'll talk more about the SleepOvation mattress towards the end of the video here, Brad. So
sure.
All right. So generally, in the past, doctors, if you'd ask a doctor, what should I use for a mattress? I'm having back pain. They would recommend a firm mattress.
Firm. You gotta sleep on a firm mattress.
And the reason, we're demonstrating right here with the wood boards. When you sleep on a firm mattress, it's going to keep your spine aligned. Everything's going to be nice and straight.
Right.
So there's no pressure. There's no pressure on the back in that regard. The problem with this is it's not comfortable as far as the points that your pressure points.
Right. Particularly if you're a little older,
Right.
Younger people are a little more tolerable of that, but
so can we get rid of this guy, Brad?
Yeah, absolutely. Let's be careful, be gentle, be gentle.
And I'm going to take rid of the boards too. So they had this study. Hold on. I'll be right back. We don't stop videos for anything.
Yeah, that's right.
Just keep going. All right. So they had this study, and I'm going to go ahead and read the title of the study. It's quite a mouthful here. The effect of firmness on chronic, non-specific low back pain, randomized, double-blind, controlled, multi-center trial.
You need to be a PhD for that one.
That's right. That's right. So it's 313 people, and they had, I think half slept on a medium firm, and the other half slept on a firm mattress. And they slept for 3 months. So it was a good trial.
Yep. Give it some time.
At the end of the 3 months, they found out the medium firm one, the one that was less firm.
Yep.
Actually, those people had less pain and less pain-related disability. They also had less daytime low back pain. So it was a clear winner.
Right. There's carryover 24 hours a day.
Yeah. So the firm mattress just lost out in that regard.
As a matter of fact, that makes sense to me, Bob, because I've had patients. They said I can sleep on a carpeted floor better than I can sleep on my mattress. And the chances are their mattress is wore out.
Yeah. They're sinking into it.
Yep. Exactly.
So the second study, Brad, I'll mention is one done by the Harvard Health Center, and they did a waiting room survey. They basically went up to people who had back pain that were in their waiting room.
And they had a little chat with them, huh?
That's right. 268 patients, and they asked, what did they sleep on? And the ones that slept on the orthopedic very firm mattresses, they had the poorest sleep quality compared to others. So again, firm mattress just did not win out in this regards.
Sure.
So now I'm going to go ahead and I'm going to talk about, what about our giveaway mattress? What's this like? So they dance around this topic a lot in describing it because they call it medium plush.
Okay.
And Brad and I both sleep on these things, so I think we kind of know what we're talking about here. When I lay down on this mattress, as you can see, even though it feels softer because it's got the 700 individual mattresses, maybe we should show that first, huh?
Well, we could, Bob.
Yeah.
While we're dragging that over here, I have slept on a memory foam type mattress, and it was a firm one. And of course, I've slept on this type. And that firm one was okay, but
this is
definitely a step up.
Yeah,
definitely more comfortable.
So this is their technology they have. They actually, and this is just a sampling of a mattress,
right?
But, you can see they have 700 of these individual mattresses, and it really spreads out the pressure points that that can give you trouble when you're sleeping.
So you got memory foam on top of a coil spring, which is a really nice combination. What are you looking for, Bob?
Well, I'm looking for I had the roll hole over here, and then all of a sudden that's gone. Is it? Oh, here it is. I got it.
This is what happens when the aging process kicks in and things, the hair goes gray and etc.
The reason Brad and I even were interested in this mattress in the
Right.
first place when they contact us is because Brad and I have been prescribing this cushion for wheelchairs for years
Right. And this is what people sit on. It gives incredible comfort.
and pressure relief.
Right. So people don't get skin
Skin
sores.
breakdown and
Right.
skin sores, and
There you go.
they actually did studies on this, Brad, that this was the best cushion for pressure relief.
You can see
So
it. It's the same concept.
yeah, it's the same concept,
you
and
go.
that's why I thought right away, bingo, this is the one we're gonna like. But
And
let me-
actually, that cushion doesn't have the cover on, just like this doesn't.
Right.
Just so you're
yeah,
clear on
for
that.
a clear
Mhm.
for clarity. All right, so now, all right, so
All
I weigh
right.
200 pounds, and you can see when I lay like this, I'm still well aligned.
Mhm.
Correct?
Yes.
Correct, Liz? She's thumbs up.
Yeah, and she got good eyes.
All right, let's say I gained 50 pounds, Brad, and that's what this kettlebell
Oh
weighs.
my! You can lift 50 pounds.
Yeah.
You got good ab strength, Bob.
Now look, have I sunk in anymore?
Well, your stomach, as look at that thing, as you put your.
I know, but have I sunk
into
into
the
the
bed.
mattress anymore? I feel like it's still being spread out.
Yeah.
It
yeah.
did.
If we take the seam of your shirt to the seam of your pants, yeah, that's very true, very accurate.
So this thing spreads out the forces, even though it feels softer.
Mm-hmm.
It spreads out the forces. It acts like a firm mattress, but yet it relieves the pressure like a soft mattress.
Sure.
So it's the best of both worlds. It's the reason we like one. So you can go ahead and try to win one, but otherwise you can also use the link below. And if you go through our link, you get $450 off. Nowhere else.
450.
Yeah, nowhere else do you get that much off. I mean,
And if you do purchase one and then you happen to win it,
right.
they'll reimburse you. Is
They'll
that correct?
reimburse you, right? So
Mhm.
don't hold off on buying one if you're thinking of buying one because the time is now.
Boy, is this QVC or what?
This is QVC. That's right. No, we're really excited about it. I think it's a great mattress, and obviously, we don't want you to feel any pressure to buy a mattress. This is a big decision, but I would keep in mind the guidelines that were set today. That you probably, if you're having back pain, you probably want a less firm mattress.
Sure.
So
Yep.
you want to go with one that's more medium firm.
There you go.
All right. Thanks everybody for watching.